Imagine a scenario where you're riding your bike unfocused, and seconds later, you lift your head up as you see a car right in front of you running closely. Your eyes widen, the way you breathe becomes hasty as your heart beats rapidly due to the shock. Thanks to the response produced, you obviously should have reacted appropriately by moving yourself and the bike away from the car and save your dear life. Or not. Those impulses mentioned are happens when you are put in a threatening situation, such as facing a near-death experience, such as potential car crash accident. But what does exactly happens inside our body during the effect of the situation? How could our body respond in that certain way? How could we save our life? What's happening? And this is what we're going to be discussing today. Introducing the endocrine system. The endocrine system, much alike as our nervous system, are responsible for the communication throughout our body. The system is our command center, a place where our reactions, responses, and actions towards something are controlled. The endocrine system communicates through what is called as hormones. Hormones are produced and secreted by the complex glands and organs scattered on our body. So as you can see from the drawing on the right, those are the glands those are the endocrine glands. But what we're going to be discussing today is specifically this one gland on top of the kidney, those two triangle-shaped glands located on top of our kidneys that are responsible in producing the adrenaline hormones and secreting the adrenaline hormones. And here is the inside view of our adrenal gland. Remember, we have one each on top of our kidney. The inside view of our adrenal gland. The adrenal gland is constructed of two parts with different hormones produced, where cortex, which is the outside region of the gland, focuses more on long-term stress, this cortex, and medulla, which is in the center of the adrenal gland that is responsible for acute stress, and in this case is the one who is responsible exactly where the adrenaline hormones are produced. So adrenal hormones are produced in the medulla, which is in the center of the adrenal glands. But now let's talk more about adrenaline. Again, let's recall adrenaline. Adrenaline effect or adrenaline rush is a reaction we do as humans, such as the scenario I described and explained in the beginning of this presentation. In adrenaline rush, you can feel anxious, nervous, or pure excitement as your body and mind are preparing for an event or specifically an endangering situation. Adrenaline triggers the infamous fight or flight response. So in this situation or in this fight or flight response, you can either choose to fight, defend your position and attack, or flight, which is give away, exit, retreat, or basically removing yourself from danger or in that situation in any way possible. Fight or flight. But what does exactly happen and how do we get adrenaline? So starting by life-endangering situations, such as, for example, taking the first scenario I explained on the first slide, which is life-endangering situation, you're riding your bike and suddenly there is a car in front of you. That's a life-endangering situation. And from here, your body will sense your environment, and the hypothalamus in your brain will alert and instruct your body to release and produce hormones to your bloodstream. So in this case, for adrenaline, the adrenaline hormones is produced in the adrenal gland. And once it's alerted, it will secrete the hormones to your bloodstream that will later on bind with the targeted cells. Targeted cells are cells that has receptors, which if done correctly, if there aren't any problem, then it should create a response and take quick action. So in this case, you will move your bike and saving your life. So from here, what can we learn? Now you know that a situation like that is an example of an experience in adrenaline. But what are the specific signs and symptoms adrenaline causes in our body? So you will feel a pounding sensation in your heart, a rapid heart rate, increased blood glucose levels, which will allow more energy for your muscles to work. That is why it could also increase the ability for you to run and lift heavy objects. It will also change your breathing into fast and shallow. It will cause fast and shallow breathing, dilated pupils, just like Tanjiro here. So things might look really bright or a little unreal. Some people might experience light sensitivity when anxious. So it basically will dilate your pupils, and you'll also feel shaky or nervous, and you'll get increased sweating. But from here, these are experiences, these are feelings that we may regularly experience every day. So from here, conclude that adrenaline doesn't always have to be experienced, or adrenaline doesn't only happen or always happen in an extreme endangering situation. Adrenaline could also be experienced in activities such as skydiving, ziplining, roller coaster, watching a scary movie, taking a test, public speaking, or even talking to someone you have a crush on or admire that will increase the level of adrenaline in your blood. So from here, we can learn that having the right amount of adrenaline could strengthen and allow you to perform better. For example, you will not feel as much pain when injured, or you can still run or fight in an injured situation. So with these abilities of the adrenaline hormones and controlling major system segments, and basically what keeps your body alive and surviving dangers for your whole life, we conclude that it is very crucial to keep your adrenaline stable. It's because the concern in adrenaline or regarding the adrenal glands is when it produces way too much or too little hormones. But we need to note that the possibility of lacking adrenaline is very rare and unusual because our body is so used to, it's basically like a basic thing in our body where we experience adrenaline. So it is very uncommon for us to lack adrenaline. So some conditions that I will later on mention may be misconceived as lack of adrenaline, which is incorrect. Because even if we lose both of our adrenal glands through disease or surgery, it will not make a significant difference. So understanding that health issues comes when we produce way too much or way too little hormones, we can start by the first disease, which is where our body doesn't produce enough certain hormones, for in this case specifically located in our adrenal gland, which is called the adrenal inefficiency, or also known as the Addison's disease. It is where we lack hormones in the adrenal glands. It is called specifically where we produce too little cortisol hormones that are responsible, that regulates blood pressure, blood sugar, and heart muscle tone. So the symptoms of adrenal inefficiency, or AI, includes dehydration, weight loss, fatigue, dizziness, low blood pressure, stomach pain, nausea, vomiting, or diarrhea. Well, on the other hand, in the second disease is where we produce too much adrenaline. It is possible for us to produce too much adrenaline, which causes this disease, which is called Theochromosatoma, which is the overproduction of adrenaline in the adrenal glands. It is a tumor in your adrenal glands that results in excess production of adrenaline. This disease will cause to anxiety, weight loss, heart palpitations, rapid heartbeat, and high blood pressure. Though Theochromosatoma is very rare, with less than 15,000 cases per year in Indonesia. And with all of those effects from this disease, if not treated, then severe or life-threatening damage to other body systems can result. And for predisposed tumor from genetics can be removed by a surgical procedure called the laparoscopic adrenalectomy surgery. I apologize if I did not pronounce that correctly. So let us recall again. Our bodies has evolved its adrenal system for over millions of years to help us survive in danger. But sometimes our body will release its hormones when it is under stress, but not in real life endangering situation, because adrenal itself comes when we experience stress, and stress is something we face regularly in daily life. So instead of recognizing real life death situations to perfectly release our adrenaline hormones, our endocrine system may distinguish emotional everyday stress such as getting burned out from piles of schoolworks, having an argument with a friend, or peer pressure, pressure from families and work, as stress that will trigger the endocrine system, that will trigger and produces the adrenaline when it's not needed. So the overexposure of adrenaline will cause digestive problems, cardiovascular disease that affects the heart, weight gain, metabolic issues, headaches, memory and concentration impairments, sleep disorders, anxiety, and depression, along with many possibilities that, if not treated well, may further damage your body mentally. In fact, some people with obesity and untreated obstructive sleep apnea that are exposed to high levels of adrenaline may lead to struggle in breathing. So from here, knowing that our endocrine system may have trouble in recognizing and differentiating real life endangering situations to chronic stress, there needs to be a prevention to the overexposure of adrenaline, because that is not something to look forward to. So what can we do? We can do so by adjusting our adrenaline. We can do so by adjusting our adrenaline levels with knowing when to turn off our adrenaline. So how can we do that? One of the core methods is by managing and recognizing our stress, practice breathing deeply, meditating, yoga, or any other methods in calming down ourselves in stressful situations. But in more serious and heavily developed issues with adrenaline, it could use several treatments that could help, such as therapy. The most effective type of therapy for most anxiety disorders could be treated by cognitive behavioral therapy, or CBT. It could also be treated by medications such as beta blockers, and could also be treated by medication or drugs that are effective in reducing adrenaline. But other than particular treatments and medications in dealing with adrenaline, why don't we also take heed in preventing any overexposure to adrenaline? We can start by applying lifestyle changes in order to maintain the sustainability of our adrenaline and the health of our endocrine system itself. By what means? By starting by practicing healthy lifestyle, such as eating a nutritious diet, get enough exercise, get proper and enough sleep, and keeping a supportive and well environment. Recognizing your family medical history is also necessary to keep up, as well as getting regular checkups to maximize the certainty of your health and well-being constantly. Because it is known, in fact, that we are blessed with all the systems in our bodies that generates in keeping our body alive and keeping us alive. But sometimes that all goes back to us and how we handle situations to determine the outcome of our well-being outside the natural control of our body. We can do so by starting to do our homework. Do not wait for it to pile up. If you have a missing assignment, do it now. This is what I'm doing right now. So do not wait for it to pile up to the point where your body identifies your chronic stress due to your lack of self-incompetence as a student, as an endangered situation, and make a wasteful production of your adrenaline hormones. So keep your endocrine system healthy. I hope you learned something from this presentation. Goodbye.